I had a small mole in my clavicle that was raised, and my mother and girlfriend bugged me to go to the dermatologist. When I finally went, he told me that I was diagnosed with a stage 1B melanoma. I was 25 and just became a cancer patient, and I didn't really know what that meant at the time. I had surgery, we removed it, and as far as I was concerned, I went on with my life. 12 years later, I went to the hospital with what I thought was a spiking fever. The doctor took a look at my chest x-ray and my blood work, and he told me, with your history of melanoma and these spots on your lungs, I'm afraid you have a recurrence of your cancer. I looked at him, I told him I think he was crazy, he must have had the Sharpe switch, but he was right. Spent 16 days in the hospital. When I left, over 2 weeks later, I had an 8-centimeter tumor removed from my bowel, and there were 4 other tumors spread between both lungs, my liver, and my spleen. My son was 4 weeks old. The treating oncologist told my wife that he'd be surprised if I were here in 2 years. When I heard that, it gave me motivation, that there was a small family that I was trying to raise that I needed to be here for. I finally found a clinical trial about 4 hours from our house, and it didn't work. The tumors got bigger. About 5 months after my initial diagnosis, I officially failed the trial. And I was looking for another hope that there would be a treatment out there that would give me a durable response. The second trial, almost immediately, you could see tumors shrinking. The first year of that trial went really well. My health started getting better. Just this summer, I had a follow-up PET scan and CT scan. That was the first official diagnosis that the cancer was gone. When you get diagnosed with cancer, it is an overwhelming thing. To be able to try to find the exact right treatment while dealing with your health, while dealing with all of the emotional and mental stress. I was fortunate that I was able to navigate that with a lot of assistance from other people. So part of what I do is try to get other patients through that process. With my blog, with a few other places that I've written for, to promote the message of find your community, find your town, find your people, and they will help you. There are people out there that have gone through this. A lot of us are very, very willing and able and passionate about helping today's patient, tomorrow's patient, next year's patient navigate their journey too.
And now for the first of this morning's Ignite speakers, please welcome TJ Sharpe.
All right.
Good morning. I was still looking for my powerful opener this week when nature, Mother Nature, and history gave it to me. As I cleaned up my front yard from Hurricane Irma on Monday, September 11th, I remembered that organic communities are created through shared trauma that bring out the best in people under the worst of circumstances. When I was diagnosed in 2000, support groups didn't exist much outside of the traditional hospital conference room. Organizations like Stupid Cancer or First Ascents weren't yet around to bring patients together, in my case, young adult cancer survivors. The tools for these communities were still being developed, but the seeds were already sown. 12 years later, things changed. I went from stage 1 to stage 4. The internet exploded in content, and social media began connecting the world on an intimate level, including small groups of patients who were sharing their experiences in real time. That first oncologist offered me the standard of care chemotherapy without the knowledge of what was happening in the cancer and melanoma research world. I knew because I was able to connect with other patients who led me to some of the groundbreaking and innovative clinical trials happening in immunotherapy. It took me 4 second opinions to find an immunotherapy clinical trial, and it took me less than 6 months to fail it. I needed a plan B, but it wasn't my doctor who found it. It was an advocate and a fellow melanoma patient who connected with me through the blog that I write. When I needed to know what the treatments she was suggesting were going to be like, when I wanted to find out what side effects were and how other patients were doing, I went to my most trusted source of information, online to my fellow patients. What I quickly found was navigating clinical trials and finding the best treatment was sort of an exercise in roadblock management. This is 459 active clinical trials for metastatic melanoma. How can we expect patients to navigate through this, especially newly diagnosed patients, and understand this wealth of knowledge they have? My first trial almost didn't start because a contract wasn't signed. And too many others that I've met along the way were unable to get the treatment they needed because they could not find or get on the right immunotherapy before it was too late for them. Now, speaking of roadblocks, pharmaceutical companies are often barred or restricted from bilateral communication with the patients they ultimately serve. What other industry in the world is this possible? Not to mention the most important one. If you look at the mission statements of those top pharmaceutical companies, you see the same themes. You see patients, people, help, discover, deliver. Yet the people that need that information are often siloed away from it in small groups or have the information buried in tabular result sets. And it's hard to see, but I am on this trial. This is the results for the trial that I currently am on. And I would have a hard time explaining to a newly diagnosed melanoma patient what this all means, and more, how it affects them. As precision medicine evolves, so must precision engagement. We need to reach those patients before they know they're even patients yet, and leverage the technologies and the communities that already exist. So when a patient realizes that their medical future has changed forever, there is something for them. The future looks like this: a big pharma scientist who became a patient and created a curated list from his background and his knowledge that helps himself and other colorectal cancer patients understand the trials and treatments that are out there for the CRC world. Patients cannot and will not wait for the industry and regulatory agencies to just figure this out. Most don't have that kind of time. Like the latest Star Wars heroine, we'll take the next chance and the next, on and on until we win or the chances are spent. Real-time information sharing and data exchange. Integrated decision support for patients and physicians. Accessible communities created and shared across all shareholders, all stakeholders. A vision of a common platform shared by all the stakeholders, where we say, this is where I lose it at the end, where we do what's possible, because, and I should have brought my note cards out, a vision for what's possible because you or your loved one will need you to do the impossible. Thank you.